there, I'm Tiffany Wuebben, and I'm so glad you're here with me today. We're tackling a subject that can truly set your practice apart: customizing care for individual patients. Dentistry isn't a one-size-fits-all profession, and patients aren't just teeth that walk through the door. They're people, each with their own stories, priorities, and needs. Today, we'll explore how tailoring care can transform patient relationships, encourage better outcomes, and make your job even more rewarding. By the end of this session, I hope you'll feel inspired to elevate your approach to patient care. To start, why is personalized care such a game changer? Because patients crave connection and understanding. People want to feel seen and valued, not just like another name on a schedule. When you take the time to customize care, you're saying, I hear you, I care about you, and I'm committed to helping you in a way that works best for you. And that makes a huge impact, not just on their oral health, but on their trust in you. So what's the bonus? You're getting satisfied patients that are more likely to return, stick to treatment plans, and refer others to your practice. Everybody wins. Now, how do we make care truly personal? It all starts with listening. The simple act of asking questions and actually paying attention to people's answers goes a long way. What concerns them most about the oral health? Are they nervous about a specific procedure? Do they have financial constraints? Or maybe they just want to know how to care for their smile better. For example, an anxious patient may appreciate extra time to discuss the treatment process or request noise-canceling headphones during their procedure. Showing that you understand and care about these details is the foundation of patient-centered care. Another essential piece of the assessment is knowing your patients better. The better you understand your patient's overall health, habits, and dental history, the better equipped you'll be able to create care plans that are tailored to them. These might mean modifying treatment for a patient with diabetes, being mindful of material selection for someone with allergies, or even adjusting approaches based on age. Because as you know, oral priorities differ from a 6-year-old to a 60-year-old, right? It's all about meeting them where they are and removing barriers to care. But what about customization in action? Here's an example. Imagine you have a patient interested in whitening their teeth, but also are struggling with tooth sensitivity. A cookie cutter approach might suggest over-the-counter whitening strips, but a customized plan takes their sensitivity into account. Maybe you recommend an in-office treatment with desensitizing agents, or create a custom tray so they can whiten gradually and comfortably. By addressing their specific concerns, you're improving their results and their experiences. Another example are dietary habits. For a patient who's frequently drinking acidic beverages, you might discuss how to minimize enamel erosion by rinsing with water or sipping with a straw after. Contrast that with a patient working on cavity prevention for them. You might focus on reducing sugar intake or adding fluoride treatments. See what I mean? Personalization is in the details. It's also important to focus on effective communication. Customizing care includes making sure your patients truly understand what you're recommending and, more importantly, why. Use visuals, analogies, or straightforward language to connect with them. For instance, explaining gum disease as a small infection that can grow might resonate better than using other clinical terminology. And don't forget to celebrate progress. Small milestones like sticking to a new flossing routine or showing improvement in gum health deserve recognition. Patients' motivation skyrockets when they feel their effort is acknowledged, and it strengthens the bond you're building with them. All right, so what's the big takeaway here? Customizing care isn't just about making patients feel special, though that's part of it. It's about creating a partnership that improves not just their oral health outcomes, but also their overall impression of your practice. It's about building trust, increasing satisfaction, and making visits to the dentist something they look forward to rather than dread. Before we finish, here's a quick recap. Your approach to personalized care should include actively listening to patients, assessing their unique needs, and tailoring every interaction to what's most important to them. Use examples like visuals and conversations to explain your recommendation clearly. And don't underestimate the power of empathy. From reducing anxiety to celebrating small wins, those little touches make a big difference. Now, here's my challenge for you. Think about one patient interaction this week where you can fine-tune your care. Maybe it's adjusting how you explain something, recommending a specific tool or technique, or adding a personal touch to make an anxious patient feel seen and supported. The beauty of customization is that it doesn't take grand gestures. It's those small, thoughtful changes that truly leave a lasting impact. Thank you so much for joining me today. Personalized care is at the heart of every great practice, and I know that you're more than capable of taking it to the next level. Keep listening, keep connecting, and keep finding ways to make every patient feel like the most important person in the room. Because you know what? They are. Take care, and I'll see you next time.